There is a conception that angioplasty is not a permanent solution to the problem of coronary artery disease, and if a person goes for it, he has to go again within a few months or years, and then the person has to go for bypass surgery. But I think it's totally wrong. And we have lots and lots of patients all over the world globally that patients angioplasty done and he is okay for 10 years, 15 years, 25 years, 30 years, like that. We have patients who are doing very well for the last 30 years. And the incidence of complications of the stent because of development of very good antiplatelet drugs and very good stents, latest generation stents, the incidence of thrombosis, the incidence of restenosis is very, very low nowadays. So it's practically a myth. Don't believe this myth. If you require an angioplasty, you go to the cardiologist and do your intervention. Don't panic. On the other hand, there are some blockages where the blockage is very exhaustive. There are blockages in all the three arteries, very long arteries. The caliber of the artery is not very good. There is no place to put a stent, so long a lesion that where you put a stent, the whole artery will be covered by the metal. So these are different factors where we don't do angioplasty and we prefer to go for bypass surgery. So that's a different situation. Some patients need bypass surgery, some patients need angioplasty. And we have got specific indications and we tell it a syntax code. Not only syntax code, several other considerations we take and they have become a modified syntax code now. So we see all these factors, we see the history of the patient in detail, and then we decide whether we go for angioplasty or we go for bypass surgery. But if he is really a candidate for angioplasty, we do it. Sometimes we do it IVAS or OCT. We don't do it in all the cases. Only 8 to 10% of our patients have IVAS or OCT when we do the angioplasty. But the results are very good in majority of the patients. And practically all the patients are surviving. Mortality is very low. It's not a major intervention. No question of cutting the ribs. No question of putting the patient to the ventilator. No question of making the patient unconscious by anesthesia. So these are the plus points of angioplasty, and immediately after 2, 3 or 4 days of the angioplasty, the patient can join his normal duties. So you can go for angioplasty. Don't worry, ladies and gentlemen, and be sure that the stent is not going to be thrombosed or re-stenosed very soon. That's not normal. Thank you very much.